Hello, everyone. My name is Shonda Banks. I'll be doing my PowerPoint presentation on caregiver stress as it relates to older adults. So, caregivers, as it relates to older adults, are anyone who provides care to someone who is suffering from a disability, illness, or injury, but particularly while doing my search caregivers as it relates to older adults. The caregivers are usually or the patient are is usually a spouse or family member. Caregiver stress can affect anyone, um, but it's more common among women. Um, and caregiver stress can result in health problems, both physical and emotional and mental health problems. Physical and emotional support is very important for caregivers as it relates as it caregiver stress. Self-care is just important as caring for the loved one that they're caring for. If they are not feeling well or at their best, how can they provide the best care for their loved one? Um, Caregiver stress can cause depression and anxiety, um, as well as many other health issues as well. Caregiver stress can lead to caregivers burnout eventually. Around 44 million caregivers are over the age of 18 or older. Caregiving include, but not limited to, bathing, dressing, administering medication, tube feedings, and ventilation care. Um, and these are a lot of, issues that, especially for older adults, that they would definitely need help for. Most caregivers are women, with 44% being men. Minority caregivers to their elders are less likely to use outside social and medical services. So, if that minority is a woman, I feel that her stress level will be even increased because her being a minority as well as being a woman. One third of caregivers have fair to poor health already when becoming caregivers. Some risk factors can include, as I just talked about, being a woman, frequent medical appointments the if the caretaker, the person that the caretaker is taking care of, if they have a condition that requires them to go to a lot of doctor's appointments or other different appointments. That's a risk factor. A risk factor is if the person that they're caring for has Alzheimer's disease and dementia. My background is in healthcare. I was a CNA for many, many years and primarily worked with Alzheimer's and dementia patients. So, just with their behavior and the side effects from the disease can cause great stress. Just thinking about if you're the primary caregiver. And another risk factor is caring for a spouse. Caregiving has been around from the beginning of time, of course. I'm sure from that everyone knows someone has done some caregiving at some point in their lives. Um, so some laws or acts that has been enacted. So Family Caregiver Alliances was enacted in 1977, And this act offers caregivers the assistance they need in educating them on care and services available, as well as conducting research on the issues and advocacy. This policy also is aimed to strengthen related policies and federal incentives. Um, also, Congress has provided $1.53 million for the National Family Caregiver Support Program under the Title III-E of the Older Americans Act, which was enacted in 2008. The National Family Caregiver Support Program was founded in 2001. This provides caregivers with information and assistance, counseling and support groups, respite, caregivers training, and supplement services. And then another law or act is the Lifespan Respite Care Act, enacted in 2006. And this act funds to develop a network of respite programs at the state and local levels, and also provides planned or emergency respite services for families um, that's taking care of not just older adults, but also children and just, young adults. Um, but Lifespan's president has yet to be founded by Congress. So Lifespan Respite is not funded through any state or local laws as of yet. So, how does this issue of caregiver stress as it relates to older adults is relevant to social work? I think it's greatly relevant to social work. Just in my personal experiences and with as being in the healthcare field, and a lot of those years, 10 plus years, was working in the home health as well as hospice agencies. So, and although I wasn't a social worker at that time, but work alongside social workers, and they help those families with different resources. They also was someone they could talk to and express their feelings of stress or overwhelmed feelings. Um, they also help the caregivers cope with day-to-day stress, as well as help caregivers decrease their stress levels. I just noticed that it's not, I said increase, but decrease their stress levels. Um, although, like I said, I was not a social worker over the years, but I did work closely with them as working, especially in hospice, where I went into the homes, and a lot of the caregivers were, spouses, or like they were taking care of one of their parents, and they were the primary caregiver. And social workers helped them with an array of different resources and things that they didn't have no idea that were available for them, as well as respite care. Some of them had never even heard of respite care. So, social work is very relevant to this issue. So, the different services um, that is available for caregivers. The first would be the AARP Family Caregiving. AARP Family Caregiving offers care guides, legal checklists, care options, and they also have an online support for all caregivers. Alzheimer's Association, the services they offer is support for individual with Alzheimer's. As I stated before, um, a risk factor is for caregiver stress if they're taking care of someone that has Alzheimer's. So I believe that associate could be very helpful for them. The Alzheimer's Association, they also have a 24-hour, 7 days a week helpline that help with tools to navigate through care. Um, Family Caregivers Alliances, they offer information, education, and services for caregivers. And the National Alliance for Caregiving offers a list of national organizations focused on family caregiving issues. So, interventions at a micro level. If I was to have a client that is a primary caregiver, at a micro level, the first thing I'm gonna ask her is about her family and friend support. What type of support does she have from them, as well as then I would ask her the relationship that she has with family, and as well as with the person she's they are taking care of. I think both of those are very important in knowing because it can help come up with the appropriate interventions. Also, I would ask about the type of illness or what caused them to be their primary caregiver. And lastly, I would ask them about their self care regimen. Like, what do they do to take care of themselves? So, an intervention that I would use at that level would be the Strengthening Family Coping Resource intervention or program. This program boosts sense of safety, um, function. It assesses the function with stability. It regulates stress reduction, reaction, emotion, and behaviors, and it also addresses or allow them or explore to make use of their supports. So the essential components of this program or intervention it would be psychoeducation, stress reduction training and practice, mindfulness and relationship repair. This intervention is usually done as a family unit. I feel that as with most caregivers that's taking care of an older adult, like I stated at the beginning of my presentation, is that most of them are family members are taking care of their parent or a spouse or anything like that. If they're experiencing caregiver stress, um, what is their family relationship with other people that could probably come in and help? Do they have siblings? Do they have aunts, uncles, or someone that helps them make the decisions or come in to help with the care or anything like that. So if not, why are those relationships strained? And how can we do to help repair those relationships to help alleviate some of the stress from you? My second intervention would be self care. I'm a big advocate on self care. I feel like if you're at your best, you can give your best to your clients. In this case, give your best to the person you're caring for. I would recommend or suggest relaxation techniques. This can be breathing techniques or anything that relaxes the muscle, the mind, help them relax and recuperate. I also would suggest things that they enjoy. What do they enjoy doing? If whether it's going out for lunch with a friend or shopping, or taking a bubble bath or listening to their favorite music or reading their favorite book. And also, I think is a big part of self care that a lot of people miss is asking for help. When you feel like you're burning out or you feel like you're very stressed, ask for help. Use your support systems for that. Okay, intervention as at a meso level. Um, at that level is I would, ask about types of services that they are currently receiving. Um, Ask about how are they involved within their community, as far as the community offer any support groups